and so mraso CNA Reverend Joseph Kofi Aidoo or your psychiatrist yene no edi nkomo efa yim hihie ene adwendwene ahodo bi eba nipa so abroni twanity friend anxiety disorder na yebedi nkomo pa we yam tan hihie wa na wo ho a wodwene ho a wonte ase wo ho yebedi nkomo pa. Hello, it's good to see you again. Yeah. How are you doing?
I'm good, and you?
By God's grace, I'm doing fine. So anxiety disorder, let's first define anxiety. Let's take anxiety no. You really a bad disorder no. Be say you di anxiety no hon komo. You rasi ansana you di disorder na bata hon. So let's define anxiety.
Okay, so Happy New Year to you.
Yes. Many happy returns. It's the first time we're meeting.
This year. Good.
So happy.
It's my main fa konya enchia etiefo ni ahwefo a omo Max TV and leadership of Max TV. Yaka anxiety Bonibaka says a mental state. There is a fear of an impending danger or threat. Say unim say bibi boni bibi to me see ana bibi a bit to me ahawesi. In the sense yemfan say ote yeti heya na yemkasa owo bi pie ha. There will be a sense of ehun bi ebeba yin na so
chaotic.
So we have this called flight or fight response. Say either say ebe try say ebe kun owo na say ebe den ebe dwane. So natural way you react to things. Anxiety na be mo asori esua de anajo for exam because ebia ehun bi o mu say we nsua de a ubetumi e fail exam no. Anxiety na say yemfa say okoye wedding bi a o dis kakra ebe tututu ho no say sa no na bia say time no do so a ho ade ankochiro. So anxiety itself no enye something bad. The way your body no responded to stress or a sense of an impending fear.
So bet me like occasional anxiety or feeling anxious every now and then. It's not a bad thing.
Oh, it's not a bad thing. It's actually a coping mechanism for everybody. So yetiena ejatoha ensimum na you unsuro se bibi be yewa. It means that you won't respond appropriately.
Yeah.
It means that obetna manasho. Iti na enkola nye ni bebre na munye anxious about something. It's akola ebe hu ja. Obetumi de sakwa kwose jam because only a sense of fear until say ahye ba akomo sa de obetumi but wo peni a wenya experience as to their eja betumi aye no won say eja no wo a won say eja ba dwane nkohia eja no
bibi huru fa sankotu
because wo sa nimde ne say there is a sense of fear and danger associated with it.
All right, so what can anxiety? Let's look at the disorder. Let's put the two of them together. Anxiety disorder. Send ya wuchire mu say enka wo ho na bi adwundwunu bi beto so kakra bi a and I say we yema shi bi hu a enka ye ade anka ye natural. Den na afi de mudi disorder abata ho. Okay,
into your case bi disorder, it means one psychologically affect you to the point say unto me and behave to say the way one can out here. Emotionally affect you, the way we juma affect you, the way we ni pantem etie affect you. Like ehunu abeye so significant to the point say one can say daily life no affect you. Into your case a disorder just say ade no nka etu obia but level now wo ato no as it is changing in quote as esesa usune oban esesa the way I would see esesa we didie mu the way I kasa the way I want to sample obo abrabo kra sa ehunu abehye oso ma say enko na say esesa like
enti asie yi o na say wo ho no de bia wadwendwene sa ma na broso we yam hihye wo de bia ma na broso enti sania wo tie no as wo ma sa yam hihye no ama asesa kakra enti nka wo obi a wotumi tena sesua wade but say wontumi nsua de wontumi nya wadwuma biom sa na wo pa kira na
enti anxiety disorders they are classes enti me the classes ne be explaining.
Okay.
You be a friend no generalized anxiety disorder. Now you can see generalized anxiety disorder. It means that ehuni esro say bibi boni beto no. It's about everyday life. And sanipa no e wo almost every day of the week for like 6 months continuous.
Let's dwell on this. Say anano me kwatra obi e wo Eastern region. Na me mada me tiso wo tiantie mboye ye adan ya wahu tefre Yes, sa no ye. Would you categorize that under anxiety disorder?
Okay. It's ye ba tefre no so there. Because you'll be using a friend of specific phobia.
Yeah.
It's generalized then say the people worry about everyday life. Bibi kakre bi anka say ye beto pipe mu. All of a sudden ye ka say ye beto pipe mu 2 days no. Now I started dwen. Na menye nso adware. Na menye nso ameden. Na me maybe den. Now I ti bibi about say bia you say accident bi esi wo kwan no so any na de me kra me ntumi mpie na me so me corner accident ba. So every basic situation ebeba no they can worry about it.
I saying they overreact to everything.
Yes. You see, we all are permitted to react to things. However, it is not supposed to be there throughout the whole week. But almost every day there is something to worry about. Like there is something that it misses also to the point say, and a disorder now means that one, nipa no unto me end that nipa no already be no tense. Nipa no tembu anani buefu. Nipa no ejuma kra oye no unto me and concentrate. Ninkita udie there is one person I know because unto me dating because osuro say boy be band broken heart. Osuro say we be breaking heart and as osuro say onye good enough for
nipa na one ne kwa out.
Every time no ordin say ono onye nipa papa I say she doesn't match up and I say in a boy we kra obepe me na we kra obepe ma say me nine the way me ti ade anka ye na ye be hu because
normal
they can worry about it like almost everything. There's a kind of my Ghana card, no Ghana card. They have to bring it to us. Because the fact that the Ghana card, no saying want to me come bank, and then you obey their transaction, and you obey their.
I say no, I ha.
Now I ha. Nipa no want to me concentrate. Nakuma eti, nakuma ebo pan. Say when you be in Ankasa now wamba, it's very very worrying. Then the second common one is what we call panic disorder.
Yeah.
So let me explain what panic disorder is. There is panic attack.
Yes.
Panic attack is a sudden intense fear about so because of something that comes to your mind. Now panic attack no our signs and symptoms. One, o sweaty. Two, akuma ebo pan. Sometimes utumi kra junso, sometimes say utumi jawanai. Sometimes u feel say bibi e choke. As a utumi embriti, as a ho e so. Once in a while we all have panic attack.
Would you link that to phobia?
Yes, so phobias. Phobias are linked to panic attacks. It's a bad phobia. The phobia and panic attack.
Okay, fine.
It is a panic attack. We are all permitted to have. Your first say, your first say, Branakoye Bibia, you are not prepared to do at once. All of a sudden, you begin to have palpitations. I won't prepare, you have palpitations. But as a panic disorder, when the panic attacks are continuous and consistent in your life, sometimes the panic attack is as a result of a fear. Say one can always say a panic attack. It's in panic also, and a panic attack normally lasts between 5 to 10 minutes, where you feel breathless, as you are confused, you feel choked, but some of them can last to as much as 1 hour. Then we have what we call phobias. There were specific phobias. Obi wa ya de ba ku bi no suro. Ye obi ho suro owo. E friend ophidophobia. Obi ho suro emema. E friend no androphobia. Obi ho suro ma e friend gynophobia. Ti your specific phobia.
Claustrophobia.
Claustrophobia so you say
xenophobia.
Like enclosed spaces osuro.
I'm claustrophobic number 1.
Yeah, ti osuro enclosed space because osuro say okoshemu na se bibi ba na we ntumi empia.
Bibi.
It is a ono kwa say enclosed space osuro.
Ebusiafo afen wa beka ye ho a ye ni Dr. Aidoo edi nkomo afa ye mhihia ebruso adwendwene ahodo ebruso a ebruso a ma se wo mu ntumi nya nia na kane no utumi ye no na ye friend of anxiety disorder ene ye di nkomo awura mu pa na nia eho hia me pa na se ye di nkomo nyina ti ase awi a kwa e befa so a e benya ahoto afiri ho nti se wonim obi a ne yam tahyehye na sebi impreduasa ase nyansa bia nim no dey bia we yam tisi dey bia na ase ustro ni do those is na friend say bibi because we Max TV say wo mu nso so there and we da mamu afidie ni and ya na me say you na Dr. Aidoo aboa. Let's continue.
The last one the specific phobias no obi o usuro pane obi to say maame na okasi bia usuro tefre there are people who tefre say tefre ba has sia ahwa ebitumi choki no the yembe hyehyere saa se bibi eba be nti obi o dia omu fear no and then who never so specific to that particular thing.
Let's address this. Ekrisofo binom bebre who was the in the name of Jesus. No, I find the Bible. No one free. I say, and things I cry, some telephone wire. Any side to say, okay. Would you say those people are actually having some anxiety disorder?
Yes. So if
it's continuous, like
and if the same thing now, nipa no all go through. It becomes we are all permitted to have
anxiety. Yeah.
But say nipa no continuous now for nipa no on to me than them because also say war get could be bonsama eba beku no like war get could ba be che no na fe on to me that dey bia waye tense na kuma tu on to me now on to me didi affect no or ye niama ani say we say nipa no toka dey bia na ne buefu say bia obi be yes say or pepa bibi ho no say o ye bibi e dey in time eba na
Obia ye bayifo, obia ye bayibu sam sa de ani wo ho. It's like they are seeing demons and witches and wizards everywhere.
So if say that specific say war get kono inti na nipa na akumetu ne sa nyama na then the fear no is specific to that. So that's an anxiety disorder. Any what last one be a friend of social phobia.
Okay.
Social phobia no is common and then more education is now obaye no. It's common in most young boys and young girls in school. Social phobia e hu you are afraid to stand in front of the public to do something. Inti okache ni pan say ombe gina ni penim embe kan buka. Na kuma be tu sa ho be gina no be funfum.
Also a bit quiet to me junso gu wo hu
yes.
Na say na woka.
Inti a lot of the kids now ebia okache ombe try their blackboard so they are avoid day and all those things. Most of them have anxiety disorders. And sometimes we don't tackle some of these things. Go through this. Anxiety disorders most of them will occur before the age of 25. Inti say ubenya anxiety disorder by age 25 now you have had your episode. Inti your uncle you go school no group work no obey by your say your friends say on class ebe present that day na homa. You be more okay so on can Bible sorry because you say on can Bible sorry that Sunday inti. Sa Sunday on ma sorry.
Yes one don nyame ana.
Yes one don nyame but obi
one bi wonimu. And anya bon Samson na dey ba we see a bibia obia will be you get a bibia broso
there are ways and say who identifies animana there were ways and means how we will deal with it. The good thing about anxiety disorders then they say but it's actually very common in females than in males.
Generally is it the commonest mental health issue we have
so
in the world?
as a disorder collectively there it is the most commonest but as individual their depression is more common than how about all the anxiety disorders in Nabuma. They are more common than any other mental health disorder. Even talking about kids, the fair BB separation anxiety disorder. Your on collabi or the entire on pay school is because Osuru says all the Nico school no free ni mamincha BBC. It is uncle and the uncle school be susa. They will fake illness, say be an itian ya na ye fro say obano de be school and move. Most of the time separation anxiety disorder that's one of the classical signs. Osuro say ye beti on any mamentem and on any papantem because say ye ti omuntema ebia bibi some kids have it. Enjoy school not because school is bad. It's because the child is having what you call separation anxiety disorder.
Me in my research, I came across one year through say over fly.
Yes.
Opportunity big beba man but on.
Yes.
Because through say of fruit plane na. Obewu an accident BBC and I say nina are categorized under.
Yes.
Car. Long distance.
Obi slow so bad driving.
But on drive.
Obi slow so bad driving. Obi crash slow so bad for car. Obi crash slow so bad for plane. There's one popular footballer, Dennis Beckham, no but Arsenal.
Yeah.
He couldn't travel by air. It's one final, no, may say because no episode they shape neko. It's the Holland Kobobo, no be decan with a shape before because Osro height anyway. There are people like that. It's a disorder.
All right. Twaso. What triggers apart from the phobias? What triggers anxiety in people?
Okay, so one of the things they say our biopsychosocial, there are some genetically or families be or they are predisposed to becoming anxious. Like
genetics.
Yes, and you say your specific gene, but you say bushebe mo say omina sa no motia say
ehufo.
Aha. And now your social upbringing. The most common factor is social upbringing. The way especially social phobia and this panic disorders ne nyama no. Ye way ye bet tin important ma unyi no. Ye baby o na unyi a unsura de.
Are you talking about the nature and nurture thing?
Yes. Ye baby out tin wa. They be ameka se me ne your girls could be Ghana very popular. Many of them go school. And
only girls in the school.
Like medical school and they are not afraid.
Okay.
Like ebia ye ka say obi be presentation or class anymore. Ada nkofo bebre edwane no mo so. Like they are not afraid. You can see the confidence and confidence now you are instilling in them from school
and that school, most of them are from affluent families.
Yes.
Into no ebusiano kakra wo ho.
And you are exposed. To say I call site to say uko site to kakra now call school be na say e ka brofu because brofu no kra won't brofu ni be that the first time I want to say brofu. So the social thing they be am say ma we shouldn't yen call and some baby questions. Omu bisa questions and my enka omu nche. One of the things are yemu bebre enye assertive enye yen to me express and now kasi obi mbetena public embe kasa say ombra TV so nyama ko bebre to me because ya kan ya said too much ye ma won express on ye din men bisa question menye our upbringing
o kasa dodo ye famre fie o kasa dodo
la ade na obisa question we nya nkola ko nya company for question company for penisem sanya mani na etumi count so naturally no nipa na nkasa no okonipa mo osuro naturally nipa no say bibi eba onto me and think outside the box to know that I'll be fine. To say you control more visa application interview. A lot of people don't do well at a visa application interview because they're anxious.
I am sure.
But obia exposed or no call interviews although there is a little bit of anxiety, they know that it is just one of those things. In short, and truth is almost all these applications they are looking at your self-confidence. But obi the first time or call oba kradi to see a crown or be do one that because interview no grant when you from 9 o'clock ne ni gusu san better na on no rest oba e bisa first question na only answer na kumetu every bisa question bibia cry ma we nya panic attack o afi obie na no to me enkasa na no awo I say bibia into me but it is most of the time the upbringing and that's why sometimes the current system of education e bi boa an kola no ye momo ye career day ye momo
round table
ye momo express your mo na ye momo bisa questions and all those things it really helps. So I think that a lot of the anxiety disorders are be at social phobia and then specific phobia ye mu bebre no ye wono our children may not deal with it if we give them the avenue to express themselves. Yanka say ma oba no enka bibia keke but correct them in love. Give them reasons why you are correcting them. And it helps them not to lose their self-confidence and their self. And one of the things I'll say is that ma obani who say you're unique.
Or strong. Or the mufua.
Obi eni what to say no. Now they will meet different people and other people who will look different from them. They are also unique in their own way. So that they don't lose their self-worth. Because sometimes I call meeting as a call class call you anxious. Because so feel say the school background yefe. The BB yefe. Until all of a sudden take class and one of the things you're anxious you cannot concentrate. You're anxious you refuse to see the bigger picture. It is an answer no solution ne kura wo ha. If it say eja wo ha. Now you're anxious. When you gate here the kura who gate. On the udwane now person ofa wo yimu na bibi e boss. You understand? So it is the nature part is also very important.
Nature no no infant any temperament.
Yes.
When you are dealing with a choleric,
that
person is confident, melancholy, that person is confident, but you deal with a phlegmatic. Oh no, they be or either that. So you need to nurture that part. You share the similarities sebi in preduasa, sebi nyado. 1 year sebi wuniska ehiafo, eni esikafo. Ube kansi supi se ya na ohia ema nipa bebre ya nso nkora kra fi poverty stricken areas eni nkora fi baabi a nipa ni se sika eni sene opportunities a wo kan ube ka se Omo differences wumpa.
Oh yes, so one of the risk factors is poor socioeconomic status. If you remember, saying kola omu free a very low socioeconomic status as a beer, baby omu free no, baby in sheda any horse no. They are more likely to have an anxiety disorder as compared to
1 year was
one more they are from an affluent family. Like the parents can encourage them and they are more exposed. You realize, ebia omono specific phobia to say bia owo yesuro owo no niamande omo but say bia yenko the one that actually helps you is the confidence to be yourself ne which me akọ kasa oni pem which me akọ tena ase a unsuro ko try exam or confidence no and one of the things I want to chip in is also anxiety related to pregnancy, especially Emma for the first time saying
and on your buy I experienced that and it shocked my BP too because I had heard about labor and all of that. So we talk about that and then we delve into the other triggers because I know so here. Me woman nine. Now each one of them means running insane and kasaba mistro labor. Ma me no musa no musi di shame tiri mu say labor is painful and all of that. And someone me my first pregnancy they be me BP because especially around the time na emraso say me wono. You were talking about that WHO is working on that seriously. Let's talk about anxiety in pregnancy. Let's talk about its dangers. Now you share other triggers no.
In our parts of the world giving birth to a child, you know, our very, very important in our lives. Sometimes one even pressure the two new couples so our mama worry for to even get pregnant. Sometimes that whole pressure no Emma in who be born more. It's not even their mind is not even right to conceive because even when omo sabi omo shia kro musuru because
6 months, 7 months, 8 months ko ye hu yire na ye hwe nefu flat. But doctors mutanka say oba eye anxious anhwa on to kosua kra na watumi afa
anxiety can affect your menstrual cycle, your ovulatory cycle. It may affect you. Sometimes say as a community, sometimes the pressure to a man so too much when it comes to our war. Na nipa no kra any insane. The way I describe it, no, you're describing it say, yeah, like go through pain. Yes, it is sometimes, especially for new mothers, first time, first no. Most of the people no BP through around the time of the pregnancy. Because the awate ne the ayaka say I want the dio say one chimia e bi kra ka say ye bebo ne niama. Last Friday ne okofo.
That's the funny people will be.
Last Friday ne okolebu. Ne okofodua. WHO ne Ghana Health Service, the Ministry of Health. We are developing a program as no pregnancy in around the 32 weeks air and pregnancy school in we will be talking about some of these things and we'll be giving them counselors. Into say ebia we show around the time you can just call your midwife, they will give you a counselor, a mental health specialist, and now mental health nurse to talk to you about it. We are trying to integrate mental health care into especially during the delivery period, pregnancy period, and even after delivery. Because even after delivery, sometimes being a new mother, and easy. Sometimes
postnatal disorders, you know,
very difficult for most of the women, and sometimes even men and grandpa so are anxious. And they don't even know what to do because fresh baby
akwa bi okoya isem so person ogina ho
obebe na dwane
ni yire wo wo person ogina ho na etu ne e de no ohwe fom
obe dwane o
labor room
minimum be oba labor ward police hospital when you mean gina for about 10 minutes like after about 5 minutes opacho no pie
and so no so obehwe
on to me like baby na cause omudu what ehuna like ehuna ntina ye ka about triggers. One of the triggers of anxiety, say, an overwhelming sense of responsibility. One, say, I also we no, a bro sooner sometimes, who feel say you are not capable of doing it a trigger. Two, say,
in say, school fees, rent, light bill, water bill, baller, BBA guniso. And one time now can.
Yeah, sometimes responsibility in the door to too much. Now, benwa, you can have a panic attack. Ebi a wotu won't your fees, won't you? When I say, and I would do bika, won't your fees now we want to say nipa no airflow. Sometimes nipa no call now. We am cry then. To me show. Nothing. I will say, you're so flow. You're sending baby the school fees. An overwhelming sense of responsibility can be a trigger.
Yeah.
2, information are adequate enough.
Misinformation.
Like, misinformation. She said, yeah, okwa visa. Yes, visa no dey say one more tie and she suit. Na okwa, yeah, kotela no makom. Mami no wo cubicle 2 no. Because cubicle 2 no say okwa. Ono dey o ma visa na papa no one no. It will do also anya main child dey do okwa one. So already no.
What abem?
Why dream no? Who nya visa? Because ya catch us papa no wo cubicle 1 no on ma visa. It's information na unya no didn't help you enough and it made you anxious. The other thing to say unrealistic expectations of yourself. Say wa the pressure to so be anxious. Unrealistic expectation. Say uti way. Unim say we need 50,000. Ako say girl be boss say obe man 30,000. Na ako say so ko say obe djuma. Na sorry ako gina na ako gina sorry na pledge say obe ma 30,000. Usu ko who need 30,000 who the GD. Now if you are sorry for fraud say patcho pledge no. If you set unrealistic goals and unrealistic expectations, you are most likely to have an anxiety.
I say akwabia you do ko GSS 1 ko SS ose 1 ko na ese wuti fie kwa kosuansa anadwuma ti you do wa koma mechanic bi eno so 1 ko obusuafo ye worried on ba no say adenia you do ko school anko edu kosua fita so awse minsua o se mpese me ye pilot. You say me ye pilot.
Eti obi say
I know nipa say
obi say unrealistic na ye do akojina plane omo say who plane no cry then we yem be show because you are setting unrealistic expectations. A lot of people are having panic attacks and fourth is lack of preparation.
Yeah.
Me say adwuma bi a wo ye bia to say the way joy mobile be adwuma you have prepared you are unimu notes unimu stuff uko ye bibi na on prepare you may have a panic attack.
Nti anopai obi we exams onsua de party enam ko a nti okotena exams
ho ye be hye wo wan obe collapse wo paper na chi wan obe collapse wo paper na chi because won prepare
yemra emoa ewo ho yewra anxiety ni mu ye pa me gidi se obi a se owo bia na se onimo obi a wo bia nipa no ehunu ba bia wo gina emoa be na ho ye nhya se mfiri nipa na mu ayem hihie a eburu so abeto ne so no mo be no obeboa ne ho ansa na wetu na manko professionals no.
Inti one of the things they say one of the theories of anxiety they say ehu any relaxation cannot exist together. Fear and relaxation cannot coexist. So we are relaxed now.
Yen kan ye ayem hihie any
abotoyem no and to me ends not together. So who aboto
ba ko ba wo se ba ko tu
baako ba o se baako tu baako wo o se baako ko nti ye fan say why relax is here wako ma ntui ba bi rem se sia na ehu a wako ma betu but say wutumi dwane na wako gina baby na ye
why relax
it's one of the things I want to say anytime we are anxious let's say call interview call kasa baby you feel relaxed it's a deep breathing exercise you take in a very deep breath then you can count like 1 2 3 4 in your head. Then you release it.
Breathe in, breathe out.
No, see, taking a deep breath. That kind 1 2 3 4. Breathe in. Also, you feel your shoulder drop, and you feel that the muscles are relaxing.
Yeah.
Good. So that's how to do it. So
deep. Doctor, we're doing it together. And opa am shishi bia beja so adwene ho a. O se hu me fa ohwenim. Na kan me ensa. Na jai mu e fa wanum. Enti yenkwe.
So say we ye new year, we be feel say o body na say muscles na kasa I relax it. MC deep breathing ye ntuaka. Deep breathing ye ndi uska.
Mita bi amo
ho. O cultural exam, just taking that deep breath and relax. O ko propose to girl bi yem sheshe, taking the deep breath and relax. O ko taking the deep breath and relax. O also come a presentation be for that 5 minutes. taking a deep breath and relax.
Provided you are prepared, because
Yes.
yes. Lack of preparation can cause some serious anxiety.
You get it? So deep breathing exercise helps. And now you will be a friend of cognitive behavioral therapy, psychotherapy. Sometimes cognitive distortion. If I say, "Ubi a ne Ghana card diary also say we know." Oba, you know, kasa, and no psychologists. We take you through a period of psychotherapy, sometimes about 12 sessions, sometimes 16 sessions. Yeah, no be kasa, and sometimes we find out niamana I distorted. Say their own name, like I said, their own names is no. Say be our Ghana card diary also want to mean yes, you Ghana. You guys say it's our passport. It's our Ghana card name you use your passport. Who need passport? Voters ID kra ewo ho. Se Ghana card ne kra na hera, you bet ma call NI akwa den. Akwa request. So distortions ne nyama say nipa because ehunti on to me ehun like all the possibilities are available no. Ye ne no e fact through.
Asema okay, e de bibia ba mitiri mu na che say obi enya ebi e the state of anxiety and also onya anxiety disorder na. Ya na say common sense in sheda anya common man sankofo.
Say the way I make no. Your mind cannot even think about possible solutions.
Wow.
You are just a now I show no pena e was like why drink e was and so and to me relax here. You see I'm say anytime we go through any period of anxiety and happy, the key aim is to find something to relax, and there are a lot of ways to relax.
Yeah.
It is a obi also here. Some of the musicians I know almost go stage to go and perform. They do recitals. It's a or umpire be a oka. Obe recite sa.
In maybe oka Psalm 23 or
in Obeka Psalm 23 is to relax him. The Psalm 23 is a prayer, but it is relaxing him. Obi tie music. Into tie music now. Obi also just
meditation.
Quiet meditation. They're just thinking about stuff. Anything to get you relaxed helps you.
Let me play the devil's advocate a little bit. 1 year, because of the fear of the 1 year guabontin, dominate guabontin one be obefa enuboni bini adene. In the end, are they going to find themselves in an even bigger state of anxiety?
Maybe I may say anything that is not natural, I would be treaty
anxiety.
Anxiety, no, you become dependent on it.
Okay.
Anything that helps you relax, you become dependent on it. Okay. It is a deep breathing now. May they relax here. Anytime I'm anxious, I rely on the deep breathing. And the deep breathing will change and affect me. And affect me liver, and affect me kidneys, and my be dependent. Say Psalm 23 now recitals na me ya.
Emma when junkie.
Emma when like Emma when a drug in quotes addict. You get it? Because a lot of people they smoke because it helps them to relax. It gives them that sense of and why do they do that? Mm-hmm. It releases dopamine in your mind.
Yeah. But doctor, I'll come for some very controversial question. But before then, I want to invite the viewers in.
Okay.
Ebi ana uwon sembusebi uwa dwinchirebi ebi ana wa fabimu ebi ana ye kasai asi abo chemsu ye pa wasempa na Dr. Aidoo ti ha okay. Unso betumi afre na oni yen ache numbers no go screen and 0558 462 088 0558 462 088 me wa ha Dr. Aidoo nso wa ha so beboa wadaroma Dr. Aidoo wa ha free if say we na free me a menya doctor me de ni okan na make bia chro but e bia na mahunu ka wahunu because enya psychiatrist papa ha and ehu hia say obebusa. You were talking about dopamine. Yes. Oxytocin.
Yes.
Any other endorphins, no?
Yeah.
So let's talk about this. One thing I know is say sex, when it's done and done right,
yes,
in the consensual, in a good ambience, Korana, it releases this oxytocin and
dopamine.
Eboa relaxing. So would you say a person who has anxiety disorder can be helped with good sex?
So in the context of, you find say all things being equal, with your correct license or driving license.
Driving license for sex.
So what driving license? I say in the right context. In the right context, in the right setting. Let's say you are in your house and let's say you have an interview an OPAB for the CEO of this company, and you are getting anxious because of the demands. Now that you fear, why not? Unya quick one be na bibia. What wakasa oh.
Why relax? Asofo bi so omo yesa o. Omo ko pretty.
Asofo bi ko pretty.
Odi kan. Ye beba ho. So far, good morning.
Good morning.
Mami, na what to say?
Acha me adu mo so e.
Onyankopon da mami ho ye. Anopen koma ye de hin fa na pese wo so ma ye.
Acha say.
So far, men tie TV no. Ene min kasa mfa wo phone mu why?
Ai, me masem nyina ne say. Me obi a se no mo ka no mi swa no mo ka manim se me yempanin sem ne nyama bebre. Ena bibini na me kasa is like minim dodo. It's now people accuse me in the church, in my family, outside. And it's like sometimes no, I mean who me want say nina minim agena na say it's like omo kamenim is like it's most any my head into man say bibini a I try say my friend go for 1 2 3 say oh ebia me obi anya akasakasa ana my bibi manye ni ye ana manka ni ye ana nipa no ma form ana bibi sa because I have me pa eti asana mo kan de say kuma me pa because even in my family me nuanum to catch me catch and say you said how can is right but yeah in gene too my husband bema me is the same thing and ama me ninji me pastor kwa me koshia no odmenya once talk to me in the presence of sorry okra Mike or to me the make challenge say who free say winning but ko shanko for mun say and it's like they attack me straight chema aya bibi na say me sure kwase me ni ko be kasa and me the nipa kasa me ni
So far, yeah, that's it. Come to yam. Doctor.
Jamaican say, don't let people's insecurity affect your confidence. In the sense that a lot of people is through omunim their stuff.
Straightforward.
Like unim stuff. Now, I say you are not like respectfully.
As we share police ni na opeso ode mra we. Now we try say unim mra.
Police is my friend. like in that same place.
I am person
like people are afraid of people are unim stuff like you are unim sending out here unim the albeit to me here. And they be because don't let people's insecurity affect your confidence. However, the way sometimes we can also communicate being so smart. Sometimes you are very, very intelligent and very smart, but once you give too much information to make others feel like
they are nothing.
They are nothing. Sometimes now dream the same thing I work on. Oh now dream was saying can be so saying can you say we so make me who baby say we say ebe mo dream was saying sometimes just
so you throw it
sometimes
back to
just saying mo dream was saying for them to say yes no it's just will save you a lot of trouble.
Ma call sprinters na ye ni happy enko kasa happy match.
Hello.
Happy Macho. Happy Utemenka. Happy.
Yeah.
Hello.
Hello.
Happy. Good morning.
Morning.
Happy. I don't know what to say. Happy. Wadauma. Any min kasa fa phone mu why? Na en come on nya de.
There wakuma to the
Happy man to wasem no.
Me say there waku to be there. No.
Ye be ba ho. Ye be ba ho. Me da sipi. Am say ye wie we na nka ya ba me question back when am pese me busa o. One year wo anxiety disorder no. E dey nsunsuan so boni pa na di ebeja won so. Ba na pese ye bua won say ni da so ho ansana ya ba ho. Enti say obi ewo saa ayemhihie anasa oni abotoyem go bibia ho de bia ne yem hihie na nsunsuan so boni be na di beja won so.
One, it may affect your relationships. It won't say even the nipa na around you now, it has a toll on them, because sometimes around them no one is trained enough to counsel you. So say you can't be back in but still unfa and sometimes it's training even a very very good relationship too. e be affect one kasa wadwuma
Yenko na hello, good morning.
Good morning.
Eva Mpacho, what to say?
Pacho me ho ye pa.
Na frefi Eva.
Kasi free of one.
All right. Eva, anopai wo adwinchire bi anasa asembusa bi Dr. Aidoo ha say.
Pacho ma ni say pant o dots na open. In that journey dots na e coming down. Pacho no so we jai. So unti.
Okay.
Unti mi bes ta ebu I'm passing and no eba from.
All right. If I had a CP, I think I get a gist. Or sini kunu enum jot. Or so enum jot na ene calm no. Na ubusa say no kre. Na but opeso wo jai. But or yes wo jai and as I am shishia beja ne so anxiety e can to kwan be ne befa so a.
So anxiety no say one pair ways to deal with it. You find something that will help you cope. And nicotine, truth is that nicotine also use it to cope with anxiety. And the more we use it, you become dependent on it. Some can say a relaxation, breathing in the bebwa, ube dependent on it. Inti say, only say nipa no say be as a cigarette na me no ma etuma me calma. Because on per se ehuno ebegu na nima se wo be binti, they will still use it. But the yawomwa or mama, if they come and see us, we will talk to the person and we will be developing strategies and find other ways to replace
the nicotine
so that he can go off the nicotine. Now, when you other strategies are already dealing with anxiety. No? Now, mami ba kunu su bisa say obi akuma to be so ben be affect we adwuma. Wan ka say
yeah another caller we dey wada ma fache. Yeah pick callers no on be boy pa. Apart from Kaswa, good morning. Apa me to nkapa ma me. Na anopai adwinchira na say sembusa.
Hello.
Apa wadama ote me nka?
Me to nka.
Aha, doctor wa ha person busa ni bibia na.
Okay, so what's not for so long I won't fabe ma. No se pima without problem na.
Okay, apa doctor ate. Lack of sex.
so what's that?
Baby na fabe ma.
Oh, W, like if you are not having sex, there are other ways to get to dopamine. Maybe I'm saying, if you have very good food, you get dopamine. Music, utie music, uye BBM, anything that's uya ebema or reward. Exercise, ebema or dopamine. Until say uyem shisho say one bema and ya. It means that there is an underlying problem. Ebia usro se bia oche. Ebia o che bia ware no ache uko wenim ebia usro se bia na daben na ebia nyame bedom na also wa ubi and I said daben na also benya be ma also be friend or boyfriend na bi eno na be ma akomutu ayem hihie na den aba ba
no bia ono ne de no wakoyi fibroid o se doctor say onwo mo nche bebre nti so wonya boy a the anxiety no beba. Hello David, good morning.
Good morning.
Bacho what is saying daddy?
Nyame adom bacha mo tuma hoye.
Onyanko pada ma ye hu ye pa. Me bacho anopai wo asembusa bi.
Me bacha ma sembusa nyina na se me yobi a majuma me yobi nti me debate ga krada ti me di dom ani na abrebi a me gina dom ani no. Me yam tash se me pa mai bo hu mo den se me jada ma ya me ntini na me buza se be na be tini aye afa ho. Ba legina do mani bia me yam da kehye na sa
ba of David me mami Musa we yam hyehyewo a wotumi agina brane eya nia ukogina dom na anim sa wo ye no
se me ya be bia prebe 10 minutes e kona fe na akoma to me yo na me tini aye de wo se me.
Okay am say doctor ebe yi ano eno na hu hia me pass me busa ne say
nti ono no say no one of the things I no they be am say ugina dom anim ye bibi continuously. In fact, we a preacher. Master your introduction. They be am say the way I was starting no is what and I ugina so e jump ko. Nti obi o kasa o continuously we be a wo depending more my presentation any ama. The way I be start introduction, the way I be introduce home, you have to rehearse it. One of the keys is that rehearsal helps you to skip that period of anxiety, no. Iti ebia o enuanom na adofo. You can rehearse it in your house.
You know, when we began radio, we used to do that a lot.
Yes.
Say so Becca so a professional, so all you need is to arm yourself with information. But me share radio, I say no. Me to me, I didn't go for me money toys. Now me the imagining that only nipa. So let's okay. Yeah, pick a last caller na Yemra. But Ufefi Taifa. Good morning.
Yes, so the you check out village. A part of it is you're not of that kind. Maybe none of smoke apartment, no cigarette, pass on papa. But no, but you know, I gave up guy. I have born better bedroom man. After I'm just around to me, call for the material, I'm to know. I deal with him, guy. It's not something that ever just born. The Mamma said, the answer, some of the sample. No, the woman at the corner, but not from you. The woman had in a mindset, not something guy.
Yeah, that's it.
Whatever they do, so it's put them to the guy every day. They said, Facebook and Facebook. But it's having a phone of them. I'm going to know. I did not stand up there. That's the bomb. Later on, after the no comment after most of them, but then after them, one I'm called about. Let me say, no, you. Yeah, man, no. Yeah, something said, and then from you. Now, you. The kid, I'm your from now. So we look like a bomb. But I am my you.
Okay.
And
all right. Yeah, that's CP.
Actually, the key to rehab, no, we cannot force people to rehab. The key to say obi best son abrab on there say the will to change. So one kasawaja to me say adie we ehame. Me pese me sesan. You almost say you can force a horse to the riverside, but you cannot force it to drink. Yeah. You get it? Say nipa no nye na adwin say adie we ehame no pese ojaya.
Yeah, most psychiatrists can denial.
Yes, ti nipa no pese obeja e bia you be or pre-contemplation stage or stage or dream was adie nkra me jaya be boa me anan boa me. Sometimes eno no ya very difficult to but nipa no gitum so pese ojaya. Then we use that as a springboard to go.
Na ye ka ensunsu so boni a se obi wa ntihie boni a ebetumi dia ba no so wo ka se ebema relationships se ye busua se ye aware ene wo mantem kra betumi wo ka se adwuma kra betumi asei
wan kasa na nkasa so no onna ebe affect onna ebe affect weight. You can either gain weight, that's obe kese obe lose weight. Even your cardiovascular system, which means hypertension, amount hypertension, area which means a stroke, amount stroke, area which means diabetes. It means kofa what be brave, bro. The last thing you say, even you as an individual, near was enka, maybe I was enka who do abrabomo no, to sing because. Say we be ko weni makoye bibi wa etwe sign. So the ultimate is that you will not get to your
na che say nia wo kan kire say obi a ne yam tan hihye no anhwe kra wo nyini nche.
Yes.
Obi a ne yam tan hihye no be wu ntem.
Yes.
Dr. Ebrena so fa bibi to obi team about excessive anxiety na phone number and answer with social media handles too.
Okay. Their mechanic say Obia FM kakra. We are all going through it. Say bibi chiro so na bibi eyo hu a. One, the ability man say you should be prepared.
Boabo
ho. Information bi a obenya no access say information we eyo no kra na enye no kra. The fact say obi FM no nchire say also we go through the same thing. We are all different people. The other thing is to say manage your expectations. Memfa expectation bibi ntun so a untumi. Now say if you are anxious, seek help.
Pemwa.
Okay. Pemwa na yen so we talk. Na yen kasa sisi an me run a clinic Madina Polyclinic Rolling Circle Mondays and Wednesdays. Ti obawa also share okasuka o share Rev and now share Reverend Dr. Aidoo. Me social media handle there me Facebook here Joseph Kofi Aidoo. Instagram here J Kofi Aidoo and Twitter J Kofi Aidoo still.
Now say him fa na wo biom.
Madina Polyclinic Rolling Circle.
Okay.
Yes.
Enti say asemo aya kan wo ho ha obi na pese okohu doctor akọ Madina Polyclinic a so wo ho dwada ene ukuada aha dwada ene ukuada ko Madina Polyclinic na kohu doctor osan Reverend Joseph Kofi Aidoo, psychiatrist. Hey, or a specialist pa.
And a bass resourceful.
Bass resourceful yo. And the bass phone you na ya da masese mo de na family.